Good afternoon, almost evening. Thank you, Chairman Craven, and members of the House Judiciary Committee. Thank you for allowing me to say a few words about this legislative package of critical gun safety reforms. I'm honored to also join Colonel Manny as a member of Governor Raimondo's cabinet, and also want to echo his comments in noting so many members of this committee who have served in the military or in law enforcement. Thank you for your service. So gun safety is absolutely a public health issue. That's why I'm here as well. In Rhode Island, there were 41 firearm deaths in 2017, the most recent year for which we have data. 19 of those 41 involved semi-automatic pistols. Nationally, we know that guns kill more than 38,000 people and cause nearly 85,000 injuries each year. In the US, firearms are the second leading cause of death among children ages 1 to 17. When you look at the Rhode Island data from 2012 through 2016, there were 170 emergency department visits and 47 hospitalizations of children for gun-related injuries in our state. Every single one of these injuries and fatalities was preventable. In the field of public health, policy plays a key role in preventing such adverse health outcomes, including deaths from firearms. We know that there is no one single policy proposal or even set of proposals that will completely eliminate the gun violence problem facing this country. However, by banning assault weapons, including certain semi-automatic pistols, by banning high-capacity magazines, and by strengthening our prohibitions related to concealed carry on school grounds, we have a chance to take tangible steps in the direction of healthier communities and healthier schools. We can do this without affecting people who use firearms in a way that is responsible, legal, and safe. Scientific research continues to affirm that access to firearms is associated with increased firearm-related deaths. This is why actions like reducing access to firearms in vulnerable areas, such as schools, and reducing their lethality by doing things like banning assault weapons, have the strong endorsement of national medical and public health organizations such as the American Medical Association. While we think about ways to prevent injuries and illnesses that are direct results of gun violence, it's also important that we consider the larger social, developmental, and emotional effects of gun violence on individuals and communities when it is misused. We know that consequences of exposure to gun violence and other adverse childhood experiences are very real. Volumes of research now make it clear that children and youth who are exposed to chronic trauma can experience inhibited brain development and emotional challenges. And among adults, this kind of fear erodes the senses of trust, cohesion, and safety that are so important to health at the community level. Things like community cohesion and trust and a healthy developmental environment are examples of what we at the Rhode Island Department of Health call the socioeconomic and environmental determinants of health. Despite all that we invest in healthcare and clinical settings, community-level socioeconomic and environmental determinants of health ultimately determine roughly 80% of our health outcomes. Everyone deserves a chance to grow up and live in a community that supports their health and well-being. That's a big part of what this package of gun safety legislation is all about. I'm honored and proud that the Rhode Island Department of Health staff joined with Colonel Manny and others on the Governor Raimondo's working group for gun safety, whose work greatly informed this legislation that has been approved and stamped by the Governor and the Attorney General before you this evening. In addition to strongly voicing my support for these bills, I want to call your attention to the other critical recommendations coming out of the working group's report, such as improving statewide data collection data integration and analysis on gun violence, and increasing public awareness of suicide prevention resources. This is work that we at the Rhode Island Department of Health are going to focus on, but we can't do it alone. We will be partnering with residents, community organizations, educators, other state agencies, and of course, we look forward to partnering with you as well. You've always been tremendous champions for the health and wellness of Rhode Islanders. And I look forward to building on that commitment and doing all we can to give every person in the state the equal opportunity to be as healthy as possible and live in the healthiest community as possible. Thank you for this opportunity.
Any questions for the director? Yes, Joe.
My friend, sure, I'm glad to see you here. Sure, I do appreciate it. And as always, everybody in this room, bear with me, losing my voice, because in politics you holler a lot, so it happens. And I appreciate your stand, especially the poor community, and what you've done at Allen's Avenue. You know, I'm going to throw that out there, so I sure do appreciate it. But in a positive way, this commission, those members, are they law enforcement that you work with? And number two, the mental illness, is that an issue that's been growing because of gun violence?
The working group for gun safety was a very diverse group that included law enforcement as well as members of all elements of our society, from academia to public health. Both individuals to my right were instrumental in it being so effective and so successful. And having the diverse perspectives were key to that success. In terms of the mental health concerns that have been mentioned, I would not say that gun violence contributes to it directly. Okay. Or having a gun contributes to that directly, but we acknowledge that there is an association that we should better understand and be aware of. There's a concept of diseases of despair, and the fact that people are dealing with mental illness, emotional wellness concerns, anxiety, depression. Those are real elements of our society. And in that realm, you would want to be cautious of what people are exposed to. There's been a lot of discussion tonight about people being well-trained and having appropriate qualifications for gun ownership. And we would want to make sure in the setting of those diseases of despair that we are aware of the relation when there is not that scenario of people using guns appropriately.
Somewhere, geez, well, I read it in the black newspaper, The Root, it comes online. And for all y'all in this room, The Root, that's what it's called. It addresses problems within the African American community. One of my apologies to you, dear lady, one of the black general doctors or whatever system they came under, I forgot how we worded it, but this is not exact quote, but a bullet is part of the health hazard as equal to a cigarette. Are we, I don't want you to put you on the spot, but are we there with that bullet to a cigarette?
We definitely know that there are impacts of gun violence that are concerning and warrant the set of bills that are before us today. It impacts communities in negative ways, and if there's a way to begin to pull back on that, then the bullet can be minimized in terms of its contribution to some of the ills and concerns of society that exist. So the bills before you today, we fully support in terms of taking those cautious steps that are needed.
You can look at us up here. There's a whole bunch of us up here. For you all out there, we all have different lives. We all have different views because we all come from different worlds. But this room is where the galaxy settles. So I really support what you're trying to do. I definitely support what the colonel's trying to do and has stood to the plate. But most of all, I wish you well and happiness with your new family.
Thank you.
Okay.